Hello, and welcome to the French Hospital Total Joint Replacement class. My name is Kristen Coyne, and I'm the Orthopedic Program Coordinator here at French Hospital. If you're watching this presentation, that means you're preparing for your upcoming total hip replacement or total knee replacement. I get to be your nurse navigator and will be here as a resource for you with any questions or concerns that you may have along the way. I'm so grateful for this opportunity to work with you throughout your entire surgery process. My goal for this discussion is to help you and your care partner or family members feel more prepared for your upcoming total joint replacement surgery. I will review what to expect here at the hospital and help you prepare for your discharge home from the hospital. Home is definitely where the healing happens, so we want to get you there as quickly and as safely as we can. And I know I can't take away 100% of anxiety surrounding surgery, but hopefully our conversation today will help to lessen those feelings for you. I'll be talking about your journey from admission to discharge, which includes your plan of care, anesthesia during your surgery, pain control and medications that you'll be taking after surgery, getting ready to go home, discharge needs, and your goals for after your surgery. What is it that you are most excited to get back to? We're here to help you reach those goals. Here at French, you truly are the hearts and souls of everything that we do. Our top priority is you as our patient, and your care will be individualized to meet your specific needs. We always encourage you to ask all of your questions and be an active member in your healthcare team so that we can provide you with the best care possible. You will have a team of individuals looking after you while you're here, working closely with you before, during, and after your surgery to get you home as quickly and as safely as possible, including your surgeon and physician's assistants, care coordinator, physical and occupational therapists, nursing staff, your orthopedic nurse navigator, and of course, your care partner. Your care partner is the person that will be helping you at home after your surgery, so we really encourage their involvement as well. Before your surgery day, you will be contacted by French Hospital to schedule a pre-admit visit. I really encourage that you come in for an in-person pre-admit visit to meet with one of our nurses to go over instructions regarding your day of surgery, arrival time, where to check in, and just to overall familiarize yourself with the hospital. You'll receive a copy of the Total Joint Replacement Patient Handbook. You will review all of your medications that you take at home. And if there's any medications that have to be stopped before surgery, those will all be reviewed with you at this pre-admit visit. You'll also get instructions on when to stop eating and drinking before surgery. And you'll receive some information about preoperative patient questionnaires. These questionnaires are self-assessments. They will come to you from French Hospital, either via phone call, text, or email. And I really encourage you to complete these surveys. There's several questions all pertaining to your level of function and pain level related to your joint. So I encourage you to complete these surveys in order to see how far that you've come. It's really neat to be able to take these surveys again a few months down the road and again 1 year down the road and be able to compare your answers to how you felt before your joint replacement surgery. I get a lot of questions about what to bring to the hospital for surgery, and my advice is always to pack light. You will not need much at all while you're here. We'll provide you with a gown to wear and a robe to cover up with when you're up walking in the hallways, socks with gripper tread on the bottom that you can wear when you're up walking so that you don't slip. You may bring a pair of your own slippers from home, but just be sure that they are easy to slip on and off to allow for some foot swelling, because you may notice that your feet have a little bit of extra swelling after surgery. Loose, comfortable clothing. Wear something comfortable to the hospital on your day of surgery and think of that as the same outfit that you'll put on that next day to go home in. Sweatpants, drawstring waists, zip-up sweatshirts, loose-fitting shirts. Avoid any non-essential items such as valuables, jewelry, home medications, and you can even leave your own equipment at home or in the car, such as a cane or a walker. We'll have everything that you need. It also helps to bring a list of your current medications and write down the day and time that you last took everything. Preventing infection after any surgery is very important. Many steps are going to be taken throughout your surgery and hospital stay in order to minimize your risk of infection. First is the chlorhexidine or Hibiclens showers. When you come in for your pre-admit visit, this will be reviewed with you as to when you're going to be taking these showers and how to use this soap correctly. It's very important that you do this in order to cleanse your skin as best as you can before your operation. You'll receive IV antibiotics given to you before, during, and subsequent doses after surgery before you go home. Any hair removal, such as shaving or waxing, I would avoid for at least 5 days prior to your surgery. If you have any hair that needs to be removed before you go into the operating room, your nurse will take care of doing that using hospital clippers. You may also receive some ointment from your surgeon, a prescription for a tube of ointment to swab inside your nostrils. And of course, good old-fashioned hand washing. Your entire team is going to be demonstrating hand hygiene at the hospital using hand sanitizer, hand foam, and soap and water. And I encourage you to continue this hand hygiene at home as well. When you come in on the day of your surgery, you're going to check in at the Day Stay 1 patient waiting room. Your nurse in Day Stay will bring you back, have you change into a gown, start your IV, check your vital signs, have you sign consent forms for your surgery. So this is a great time for you and your care partner to ask any questions. Your anesthesiologist that's going to be taking care of you during your surgery will come in and meet with you during this time. So any questions you have related to anesthesia or what to expect after surgery, they're a great person to ask, and I encourage you to go over those questions with them together. Last but not least, your surgeon will come in and greet you, and they will take a marker and autograph either your hip or your knee, whichever side is going to be replaced, and verify with you when they put their signature on you that they're going to be operating on the correct joint. Your operating room nurse will come to pick you up at this time and take you down the hallway for surgery. Surgery times vary depending on the type of procedure that you're having done, but typically you can expect that your surgery will last anywhere from 2 to 3 hours, start to finish. After your surgery is complete, you'll be transferred to the recovery room or the PACU, and you'll spend about 1 hour here in the PACU. During this time frame, you're not allowed to have any visitors or family members back with you, but your family or care partners are welcome to wait here at the hospital, either in our front lobby, healing garden. The cafeteria should be open if they're hungry or need a snack, or in the family waiting room next to Day Stay. These patient tracking boards are located in the main lobby of the hospital. I encourage your care partner to check in at the front desk with the volunteers, and they can help your loved one or care partners locate where you are along the way using these tracker boards. After surgery is done, you'll be transferred to the recovery room, and this is where you'll wake up after surgery. You'll have a nurse checking your vital signs frequently, asking you about your pain level and how you're feeling, and making sure that you're recovering after having anesthesia. Some side effects that we sometimes see after anesthesia with any surgery are low blood pressure, nausea, some dizziness or lightheadedness, and difficulty with voiding. You will not have a catheter inserted into your bladder, so sometimes that sensation to void can sometimes take a little bit of time to wake up or come back after having a spinal administered during surgery. Just know that this may take some time, but will come back, and your nurses will help to keep you comfortable and dry. You will have compression stockings on both legs You may not feel them there, but they are inflating and deflating with air continuously so that they're massaging your legs and doing the circulation for you while you're not able to get up quite yet and take a walk. After you're finished in the recovery room and once it's safe for you to be transferred, your nurse will bring you either to your hospital room if you're staying the night or back to the day stay 2 department if your plan is to go home the same day of surgery. If you're staying the night, here's a photo of one of our hospital rooms, and this is most likely what your room will look like as well. Your nurses will get you settled in bed, show you how the bed controls work, how to use the call light, the television, and familiarize you with the care board that's on the wall across from your bed. This is a great way for your nurses to write down medications that are due, the names of all of your healthcare providers, make notes for the care coordinator regarding anything you may need at discharge, and write down your family member or care partner's name and phone number. If your goal is to go home on the day of surgery, just know that you will not be admitted to a hospital room, but instead transferred directly back to day stay. You'll be in our day stay 2 department. And our goals for you for a safe discharge include working with physical therapy and occupational therapy within the first few hours after surgery. Your pain is well managed with oral medications prescribed by your surgeon. You're eating, you're drinking, not feeling any nausea or vomiting, stable vital signs, your blood pressures are stable, you're not having any dizziness or lightheadedness while you're sitting up or standing. And I really do encourage your care partner to be here throughout the afternoon as well. If they go home during surgery, that's perfectly fine. We'll be able to reach out to them once you're back in day stay and give them a time frame for the day so that they can come back and be with you to be a part of all of the teaching and the physical therapy session before you go home. Sessions with physical and occupational therapy in day stay 2, they'll go over the goals with you for that day, but our expectations are that you can get yourself safely in and out of your bed, to and from the bathroom, walking about 80 feet or more if tolerated, and safely navigating up and down stairs if you have stairs at home that you have to climb, and on and off of a curb height step as well. Doing all of this safely using a front wheel walker. They'll also review activities of daily living with you, such as showering, getting dressed, using the toilet, putting on socks and shoes, and practicing ways to make things easy for you when you go home from the hospital. Again, I really encourage that care partner is here and present for all of this teaching and instruction. If your surgeon prefers that you have home health physical therapy, this will be arranged prior to your surgery date, and I will take care of confirming that that's all been done and follow up with you on your day of surgery to make sure that they've contacted you. Also, be sure to pick up your front wheel walker ahead of time. Ask your surgeon's office for a prescription for a front wheel walker if you need a new one. And also make sure all of your prescription medications have already been picked up at your pharmacy. So that way you have all of your pain medications ready to go at home. You don't need to bring those medications to the hospital with you. They can stay home, and your nurses will administer medications to you through our pharmacy. If your goal is to stay overnight in the hospital after surgery, just know that your healthcare team is continually assessing how you're doing, checking on your needs, and physical therapy is also going to continue to work with you until you're ready for a safe discharge home. You'll be given an incentive spirometer and taught how to use this, and I encourage you to take this home with you to continue using it for some deep breathing exercises at home. It's important to get our lungs moving after surgery. Sometimes after anesthesia or when you're taking pain medications, our lungs get pretty relaxed and sticky. And so it's important for us to open up our airways again. It prevents fever and prevents pneumonia. After your surgery, our goal is to keep you as comfortable as possible. So your nurses are going to be talking with you a lot about your pain level, your acceptable level of pain, and medications that are available to take to treat your pain. We would love for your pain to be at a level 0, but unfortunately, I can't promise that. And it's definitely not realistic, especially after such a big surgery. But keep in mind, we want to keep you at a manageable level that's tolerable for you so that you can still participate in your care, work with physical therapy, do your exercises, and go home. Oral pain medications will be prescribed by your surgeons, such as an opioid medication, for example, oxycodone, an anti-inflammatory, and Tylenol. Your nurse will administer usually all three of those throughout the day to keep your pain well managed for you. We only use IV pain medication for breakthrough pain that's not controlled already with those oral medications. Our goal is to try to avoid the use of the IV medications because they can cause you to feel really dizzy, lightheaded, nauseous, cause vomiting, and increase sleepiness. And if you're too sleepy to participate in PT, you're not going to be able to get up and move and won't be able to go home as quickly as you'd like. So we'll work really closely with you to make sure that your pain is kept at a manageable level for you. Some other methods of pain relief: icing and elevating, repositioning so that you're in a comfortable position, listening to music, reading a good book, watching a TV show or a movie, or listening to a podcast. Those are all great methods of distraction. If your plan is to stay overnight after surgery, usually one night stay is all that's needed, and you'll go home the next day depending on your medical status. We'll make sure vital signs are stable, you're not having any fevers, your dressing is clean and dry. Again, pain is controlled with oral medications. You're eating and you're drinking and tolerating food, not feeling dizzy when you're up walking with physical therapy. And again, depending on function with physical therapy as well, you're able to get out of bed, in and out of a chair, and to and from the bathroom, relatively unassisted, using a front wheel walker, and you're walking in the hallway about 75 to 100 feet. And if you have stairs at home, you'll be practicing going up and down those stairs so that your physical therapist can make sure that you're safely doing that correctly. Once you're ready to go home, your surgeon will write all of your discharge instructions out. Your care coordinator will check in to make sure that you're all set to go home and that you have everything that you need before you leave the hospital. Your nurse will print out a packet of paperwork for you. They'll review education from your surgeon, such as how to take care of your incision, pain control, and medications that were prescribed for pain, and also go over any new medications that have been prescribed, such as aspirin or some type of blood thinner. You'll be taking those blood thinner medications usually for about 4 to 6 weeks. Follow your surgeon's instructions as to when to stop taking those. And your nurse will also make sure that you have a follow-up appointment scheduled with your surgeon. The best thing to do ahead of time is to make sure that your house is prepared for you to come home to. Preparing your house will make it so much easier once you get there. Clear your walkways of any clutter. Make sure there's nothing running along the floor that could potentially catch on your walker. Remove any throw rugs or cords from the floor. Make sure you have a non-slip rug in your bathroom, something that's secure and safe for you to step out of the shower onto. And again, make sure that your care partner is able to assist you for at least the first few days at home as you're recovering. And ensure that you already have your front wheel walker. And here's a picture of that front wheel walker, just 2 wheels in front, pegs in the back. Ask your surgeon's office for a prescription so that you can get this picked up ahead of time. If your toilet is low to the floor, I do recommend getting a toilet seat riser, and that's pictured on the right. It brings the height of your toilet up about 6 inches and also has grab bars on both sides, making it easier for you to sit down and stand up off of your toilet. They also make frame handlebars, such as the picture in the middle, that you could get if height is not an issue. You just need extra handlebars to hold onto as you're standing and sitting down. And of course, grab bars. I'm also a fan of grab bars for inside the shower. Please let me know if you need help finding any medical equipment for at home. I'm happy to help you find something that's priced correctly for you, and there's lots of different places where you can shop for these items. Continuing to take care of yourself at home. Keeping track of your medications is really important. So I encourage that you write everything down. Use a chart, use your phone, a calendar, whatever works best for you so that you don't accidentally fall behind on any dosages of your pain medication or skip anything. Constipation can definitely occur, especially when we're taking opioid pain medications. So make sure you're drinking lots of water, increase your fluid intake, take some stool softeners. Over the counter laxative are also great to have at home. Continue good hand washing to prevent infection, and progress with your activity. Each day you're going to feel stronger and be able to do a little bit more. But listen to your body. And also be sure that you're frequently taking breaks so that you're elevating your legs, you're icing your hip or your knee, and that will really help with bringing down your swelling and make walking and range of motion exercises easier for you. Here's a picture of what I want it to look like when you're resting, elevating, and icing at home. Use a few pillows to prop up your leg and lay as flat as you comfortably can. You can still have a pillow behind your head. Use a few pillows to get your ankle above heart level. This will really allow gravity to help decrease that fluid retention in your leg. You may even see swelling down into your ankle and foot. That's all normal after surgery. So gravity will help to decrease that swelling. This is a great time for you to rest, take a nap, apply your ice packs to your hip or to your knee, and take a break and stay off your feet. Every 4 hours for at least 1 hour is our goal for you at a minimum. What to expect during your visits with physical therapy. So whether your physical therapy is taking place at home or at an outpatient physical therapy center, the goals are all the same. They're going to continue working with you on range of motion, strength training and balance, safety. They're going to help you progress from your walker and graduate to a cane when it's appropriate. And it's also a great extra set of eyes to check your incision, your dressing site, and communicate with your surgeon if needed. Here's some homework for you. Pictures are so valuable to us here at the hospital. If you have a stairwell at home, outdoor steps, a bathroom that may be a bit of a challenge for you to navigate after surgery, please take photos and bring those in on your phone and show those to your physical therapist and your occupational therapist. That way they can help you to navigate what to expect when you get home using those photos. I've also had patients measure the height of their bed and bring in those measurements so that way we can bring your hospital bed up to the same height that your bed is at home so you can practice getting yourself safely in and out and get a good feel for what that's going to be like. Always remember that each and every day you are making progress in the right direction. Even if you don't see it right away, just know that it's happening. You are going to get back to your independence. You're going to reach your goals. You're going to get back to doing what you love to do. We are here to support you throughout that entire journey. We are so grateful again for the opportunity to take care of you here at French Hospital. I'm really looking forward to meeting you soon and following along with you. If you have any questions, here is my contact information. Please don't hesitate to reach out to me with any questions. My phone number and my email are both on this slide. And again, I thank you so much for your time and for your attention and can't wait to meet you and work with you very soon. Take care and have a wonderful day.